Good morning, Shamina. How's everything going?
Everything is well. My morning sickness is starting to subside, but I have this crazy Oreo craving.
I'm glad the morning sickness is starting to subside. As for those cravings, they are normal. Just make sure you're balancing everything out with a healthy diet. A healthy mom is a healthy baby. Is there anything else bothering you or any concerns that you have?
Well, I do have sensitivity and bleeding in my gums when I brush. Is that normal?
Well, have you been to the dentist lately?
No, I just was scared because of the baby.
A lot of women think this. It's absolutely safe to visit the dentist for routine cleanings. Actually, I recommend that you make an appointment. The swelling of your gums that you mentioned is most likely from the increased level of progesterone from being pregnant. About 40% of women suffer from pregnancy gingivitis.
I don't know how I feel about going to the dentist. I want a homeopathic style pregnancy.
I think this is great, but my concern is if you leave this issue untreated, damage to not only you, but the baby can happen.
What do you mean?
When your mouth is harboring bad bacteria from perio disease, there is a possibility that the bacteria can enter into your bloodstream and penetrate the sac around the baby. This can cause an infection within the baby. Another thing that is a little bit more serious that you need to be aware of is hypertension, low birth weight, and even preterm delivery. I know you're hoping to stay away from additional treatment and antibiotics, but I want you to be aware of all of these possibilities.
Oh my gosh, are you serious? I had no idea. I'll make an appointment immediately. Is there anything else I can do at home in the meantime?
Absolutely. First and foremost, a healthy diet is extremely important. Adding more calcium foods to your diet, such as milk, cheese, even eggs, will aid in healthy bones, including your teeth. Also, you can try gargling sea salt, clove oil, or aloe vera.
Okay, thank you.
Hi Shamina, how you doing?
Hi, how are you?
Good, congratulations on the pregnancy. How's that treating you so far?
It's good so far.
Great, so before we have Dr. Heckman come in and take a look, I want to know if you had any changes or concerns since your last visit with us.
Well, a few weeks ago, I noticed sensitivity, redness, and swelling in my gums. And in my last OBGYN appointment, I mentioned this to her, and she said I might have gingivitis. And I know that it's common in pregnant women. And she said it could potentially harm the baby.
Actually, pregnancy gingivitis is very common, and after Dr. Heckman comes in and takes a look, I feel she will be able to get your concerns under control. Okay, so she'll be right in to see you, alright?
Thank you.
Hi Shamina, I hear you're experiencing some discomfort and gingival issues.
Yes.
Alright, can I take a look please?
Sure.
Alright, I see some swelling and bleeding a little. You might have gingivitis.
Oh no, can it be cured?
Yes, gingivitis is inflammation of the gums caused by a bacteria infection. In your case, the change in hormones has given this bad bacteria the ability to flourish. Once it is under control, the symptoms will subside. I'm going to let Beth take over and clean your teeth, and after, I will have you meet my assistant to talk about some home prevention care.
Okay. Thank you.
Thank you.
Hello again, Shamina. How are you feeling after your cleaning?
Well, it's sore, but I feel a little bit better after the cleaning.
Okay, great. So I wanted to go over a few things with you and a few things that you can do in the future. To start, I want to talk about brushing. I know it seems really simple, but when you're experiencing a lot of morning sickness like you have, it's very important not to brush your teeth immediately after. That actually harms your enamel more. A better option is to use a rinse, like mouthwash. You can use any mouthwash. We have Listerine. Make sure it's alcohol-free. Or you can use a sugar-free chewing gum and then brush approximately 30 minutes after.
Okay, I'll pick up some sugar-free gum and some more mouthwash right away.
Okay, great. Dr. Heckman will be right in to go over a few questions with you, or if you have any more concerns, and I'll meet you out in the lobby to schedule a next appointment, okay?
Okay, thank you.
You're welcome.
So I hear you handled your cleaning beautifully. I am a little concerned about the progression of your gingivitis. In addition to brushing, flossing, and an antibacterial rinse, like Listerine, I'd like to put you on an antibiotic for 7 days to help get the inflammation under control.
Is it safe for my baby to be on antibiotics?
Antibiotics like amoxicillin are safe while pregnant. I will write you a script, but you have to contact your OBGYN if you have any further concerns.
Okay, thank you so much, Dr. Hepburn.
If you need anything between now and your next appointment, don't hesitate to call.
Okay, thank you.